Hey everyone, how you doing? My name's Gus. I'm an implant dentist and cosmetic dentist based around London in the UK. And today I want to look at something which a couple of our viewers on this channel have mentioned, and that is the comparison between a 3-on-6 implant system and an all-on-4 implant system. Okay, so just to bring everyone up to date, both of these solutions are designed for people who have got no teeth, or they're in a situation where they've got very bad teeth and they all need to be removed. An all-on-4 kind of system, okay, and I'm going to say kind of system because all-on-4 is specific product made by Nobel Biocare, which is a really well-established implant company. So an all-on-4 kind of system is where you typically take 4 implants and you put 2 at the front, 2 at the back, and the back ones are angled. Okay, so I'll explain why they're angled in a minute. And then on 4 implants you have a full set of teeth made. Now typically this full set of teeth has gum on it, fake gum. Okay, so your natural gum is flat and is higher up, it's higher than your lip is covering, and then you have the fake gum which is a little bit visible, and then you have your teeth on there. Okay, and this in my opinion has a lot of advantages doing it like that. The 3-on-6 system is slightly different, so you would have 6 implants placed for the full set of teeth. And then on those 6 implants, you then have 3 individual bridges made, okay? And on their website, they've got a lovely diagram explaining how this is done. But one of their unique selling points is that there is no fake gum, okay? So I'll come on to why I think this is a bit of an issue in a minute. Now, both of these are products, okay, and that both of these are examples of people trying to productize a treatment, right, a medical treatment. Typically what would happen is, you know, you have a problem, or somebody has a problem, they come in to see someone who can fix that problem. So if I had a leaking pipe, I would call a plumber who would come in, look at the problem, diagnose it, see why it's leaking, see what the problem with the system is, and then take corrective steps to fix that. Okay, but here what's kind of happening, and this is a general trend in medicine, is that people are self-diagnosing at home and then thinking, oh, you know what, I really need this all-on-4 treatment or this 3-on-6 treatment. Then they go online and they find an all-on-4 or 3-on-6 provider, and this can be a little bit dangerous because I would say about 2 people who come to see me every month, not in lockdown obviously, but yeah, they come and see me and they're convinced that they want to have all-on-4 treatment, and they generally dislike it when I say, actually, you know what, we can save what you've got. But that aside, right, the whole thinking behind an all-on-4 or the 3-on-6 is nothing new, okay? These are treatment possibilities which have been around for a very long time, but what these companies have done is just put a label on it and selling it as their own thing, okay? So the 3-on-6 having implant bridges has been done for forever and a day, and all they've done here is said, okay, you know what, instead of having one long bridge, let's make 3 separate bridges. Okay, and their website is very pretty. You know, it really explains the process pretty well. They don't have that many before and afters. Okay, they got a couple, because nobody would sign up if there was no before and afters. You have to sell the dream on the website. And they say, you know, the process, I'm going to go through the process, and there's some elements here which I do strongly agree with, which are really, really good. Okay, have a consultation first of all, that makes sense. Have the implant surgery, at which point you will have a removable denture, okay, as a temporary measure. So this is a key difference. With the all-on-4, typically you don't walk out with a removable denture while the implants are healing. Okay, but they say if it's suitable, you can have a full arch temporary bridge, which is what you would walk out with an all-on-4 treatment. Okay, and then they say step 3 is they'll make what I call in my clinic a trial smile, so a smile made out of temporary materials, which I 100% recommend. You know, this is a really good way of doing it. And then once you're happy with the aesthetics and the bite, you have it processed in porcelain. Okay, and that's where you make the 3 porcelain bridges. Then you have the final bridges made. Then, if we scroll down to the features part of the website, and these features tables, right, they're so common, you'll see them on so many websites. My biggest problem is the questions which they ask are heavily skewed towards the system that they're trying to promote, okay? So here is, if you look at the all-on-4 column versus the 3-on-6 column, you'll see they're very similar, okay? But it says here that the 3-on-6 never needs to be removed by a dentist, okay? I would completely disagree with this. If I've got a patient who's got a bridge, an implant bridge, okay, especially if it's a screw retained implant bridge, which is easy to remove, and all the all-on-4 ones are all screw retained, then I would recommend removing it, inspecting the implants periodically, maybe once a year, once 2 years, and then putting it back. Okay, so even if you've got 3 individual bridges, I would still recommend to remove it and have it. And then feels and functions like natural teeth. No implant is going to feel exactly like a natural tooth. There's a couple of very, I wouldn't say big differences, okay, because the patients who have all-on-4, they say that, you know, it all feels really nice and feels really natural. And I assume that the people who have the 3-on-6 or whatever you're selling, you know, full arch implant system, they're going to say that it feels natural because it will feel much more natural than the situation that they've just come out of. But natural teeth have a little ligament, they've got a little bit of movement, whereas implants have no movement, they are solidly anchored into bone. Okay, they say that it's smaller and thinner as well. Again, I would disagree with this. You know, the all-on-4 bar with all of the teeth on it can be made to be very, very thin, and pretty much as thin as the as a bridge on implants, which, you know, again, we do that quite a lot in the right kind of situation. And then, you know, they don't give any idea on pricing. They've got all this stuff, all these questions which they answer, the FAQs at the bottom. And it says the all-on-4 is a larger, bulkier thing, feels unnatural. I would completely disagree with this. For all the patients who we do this for, we make it as thin as possible. And I've never had a patient complain that the final set of teeth is too thick. Okay, they do, sometimes patients will complain that the temporaries feel thick and they interfere with speech and things like that. That's normal because the temporaries are made from plastic. Plastic needs to be thick to give it a little bit of strength. Okay, so all-on-4, like, yeah, okay, this system seems suitable, okay, and I would always judge a system on, does it transform the patient's life? Okay, really, it doesn't matter what brand or what, you know, what you have. I would always say have good quality implants, but it doesn't matter whether you go 3-on-6, all-on-4, whatever, as long as it transforms your life and it takes you from a position where you're not able to eat, or you feel really self-conscious about the way your teeth look, and it takes you from there and takes you to a place where you feel really great about your smile. You don't need to worry about covering it up. You can eat whatever you want, and when you go to a restaurant, okay, it doesn't matter whether you have 3-on-6 or all-on-4 or whatever it is. My slight issue with this system is the fact that they advocate no gums. Okay, now the reason for this is I'm coming very much from an aesthetic background, okay, and in order to create a beautiful smile, one of the key things that we have to get right is how much top tooth is on show when the patient is talking, okay? So we can judge this. Sometimes we'll ask the patient to say the letter M and let their lips just rest, and then we take a photo and then we take a measurement of that, the amount of tooth. Okay, so that dictates how long the teeth should be. And then we have what we call our height-width ratio. So the width of a central incisor, the front tooth right in the middle, the biggest one, the width of it should be about 75 to 80% of the height of the tooth. Okay, and then once you've got all the teeth in position, the height is typically about 11 millimeters. So that dictates how high the tooth should be. Okay, so remember, on the 3-on-6, all you've got is the teeth sitting on gum. Now, when you have teeth removed, you lose gum. okay, which means your implants have to be placed higher up. And not only do you lose gum, you definitely lose what we call the papillae. The papillae is the pink triangles between gums. Every single full arch case which I've seen done without any pink gum has always compromised the aesthetics, because they, to minimize this pink triangle, which is what you have to do, you have to flatten the gums really, to make it look okay, what they do is make the teeth look more square. Okay, so in between each tooth you have a contact area. Now that contact area, or a contact point as it is in perfect health, it needs to be about 5 millimeters from the gum. Okay, and then we know we're going to get this sort of pink triangle fill-in. But if you don't have any teeth there, then that distance becomes a lot smaller, which means if you have two implants next to each other, it's going to be very difficult to get that pink gum looking natural there. So what you do is you make the teeth look more rectangular than oval, and that will hide this pink triangle below the lips. Okay, so if you look at all of the All-on-6 photos that we've got here, none of the cases will show that pink gum. Okay, and that is important, because sometimes when my patients laugh, you know, freely, not just smile but really laugh, you can see that high up. And from an aesthetic point of view, I always think it's nice to get that looking really good as well. Okay, and the best way that we found to do that is to add gum onto the teeth. Now, I don't want to be kind of saying one system's better than the other. You know, I don't even use All-on-4. In fact, I did a bit of research on this 3-on-6 thing, and they actually use the same implants that I use 80 to 90% of the time. Okay, so there's no problems in the types of implants which are used here. There's no problems with the overall results, right? If it transforms the patient's life, that's excellent. I do have a slight issue with productizing dentistry like this, okay, because it's now a case where patients call up, and this has happened with orthodontics, with Invisalign and things. Patients call up saying, hey, look, can I have All-on-4? Can I have 3-on-6? Or do you do 3-on-6? Do you do All-on-4? There used to be a time where it would be like, okay, look, I've got this problem. What are my options? How can I fix this? Okay, and that's kind of the way that I still work. And I know that I put off a couple of patients every month who come in wanting All-on-4, and I know there's a better way. So I tell them that, so they hear my opinion, but very few of those guys actually come back for treatment. Okay, so I hope this has been useful. If you've got questions, comments, you can always put them below. I do read all the comments, and I try to respond to as many as I can. Okay, so until next time, take care. Hey guys, okay, so I recorded that whole video and I forgot to mention the issue with the very back implants. So the reason on an All-on-4 kind of treatment, the back implants are angled forward. So the top ones are tipped forward like that, and the lower ones, instead of being straight down, are tipped forward like that. The reason for doing this is to avoid things like the air sinus at the top. Okay, so when you lose all of your teeth, your air sinus expands, and in order to get your teeth as far back as possible, the back implants need to be tilted forward. Now, you can have implants going straight up, but you need to have what we call a sinus lift done first to do that. So I assume that with this 3-on-6, they're either using a sinus lift or maybe even something called a pterygoid implant, which is an implant which goes much further back. On the lower jaw, there's the nerve which we need to avoid. Okay, so there's a nerve which runs inside the middle of the jawbone. It goes all the way down and it comes out around here, kind of like midpoint where your corner of your lip is. It comes out there. So again, with the All-on-4, we're angling the implant, sort of the bottom of the implant forward, so that we're avoiding this nerve. Now, if you want to put your implants further back, sometimes you can do it if there's still enough bone there, but you need to use much shorter implants to do that. So again, I'm just comparing and contrasting this 3-on-6 versus the All-on-4. All right, take care.